What is anovulation in female infertility? Have you ever wondered why some women struggle to conceive? One significant factor can be anovulation. Anovulation is a medical condition where a woman's ovaries fail to release an egg during her menstrual cycle. This means that without ovulation, there is no egg available for fertilization, which can lead to infertility. Anovulation is a common cause of female infertility, accounting for about 25 to 30% of infertility cases worldwide. Typically, ovulation occurs around the midpoint of the menstrual cycle. This process is regulated by a series of hormonal signals. The hypothalamus in the brain releases gonadotropin-releasing hormone, which prompts the pituitary gland to secrete follicle-stimulating hormone and luteinizing hormone. These hormones work together to stimulate the growth of egg follicles and the releases of a mature egg. If any part of this hormonal sequence is disrupted, ovulation may not happen, resulting in an anovulatory cycle. Women experiencing anovulation often notice irregular menstrual cycles or may even miss their periods altogether. Some women might have bleeding that resembles a normal period, which can lead to confusion about their fertility status. Several factors can cause anovulation. One of the most common is Polycystic Ovary Syndrome, or PCOS. This condition is characterized by hormonal imbalances, including elevated levels of male hormones like testosterone. These imbalances can interfere with normal follicle development and ovulation. In some populations, PCOS accounts for up to 70% of anovulation cases. Another cause is hypothalamic dysfunction. This can occur due to stress, excessive exercise, or eating disorders, which can reduce the secretion of gonadotropin-releasing hormone. This reduction leads to decreased follicle-stimulating hormone and luteinizing hormone, ultimately resulting in anovulation. Premature ovarian insufficiency is another factor. This condition involves the early loss of ovarian function before the age of 40, which can lead to anovulation and infertility. Additionally, elevated prolactin levels due to disorders of the pituitary gland can disrupt the ovulation process. From the perspective of fertility and endometriosis, it's important to know that while endometriosis primarily affects fertility through pelvic adhesions and inflammation, it can also contribute to ovulatory dysfunction in some cases. Women with endometriosis may experience hormonal imbalances or altered ovarian function, which can lead to anovulation and further complicate their fertility challenges. Treatment for anovulation varies based on the underlying cause. It often includes lifestyle changes, hormonal therapies to restore ovulation, and, if necessary, assisted reproductive technologies. Since anovulation is a treatable cause of infertility, early diagnosis and management are crucial for improving fertility outcomes. In summary, anovulation is the failure to release an egg during the menstrual cycle, making it a key factor in female infertility. It is often caused by hormonal imbalances, such as those seen in Polycystic Ovary Syndrome, hypothalamic dysfunction, or premature ovarian failure. Understanding and addressing anovulation is vital in managing infertility, especially for women with conditions like endometriosis that may affect ovarian function. If you suspect you might be experiencing anovulation, consulting a healthcare professional is essential for personalized advice and treatment options.